Okay, we're doing this book here now, Prevent and Reverse Parkinson's Disease and Chronic Fatigue Syndrome by me, Pete Rogers. This will be part 4, lecture number 4 on it. I'm going to be talking about atherosclerosis. If you watch a lot of videos on my channel, you've seen me talk about atherosclerosis before, but a lot of people haven't, so I'm going to go through a bunch of this stuff. I'm mostly going to go through the pictures. Okay, academic orgasm number 1. What is atherosclerosis? It is a blood clot. And I know, I can tell you, doctors, they don't know anything about atherosclerosis. They're a bunch of idiots, okay? Conventional medical books, they're close to worthless, okay? You can use them as toilet paper, internal medicine textbooks, and that includes the ones by Harvard and all the Ivy League schools. They always say the same thing. We don't know what causes it. It's associated with aging, seems to be partly genetic, might be due to socioeconomic disparities. They act like they're sensitive and thoughtful. They're a bunch of stupid lying jerks, okay? We know what causes atherosclerosis. It's a blood clot, all right? And I've talked to pathologists like Gregory Sloop, the world pioneer of atherothrombosis here. He says, you look under a microscope, it's a blood clot. William Roberts, he looks at it under a microscope, he says it's a blood clot. And that gives you a tremendous amount of power once you get that concept, because then you know anything that causes blood to clot increases the risk of atherosclerosis. Cholesterol is a risk factor because LDL cholesterol sticks red blood cells together. Red blood cells have a negative charge on their outer surface called a zeta potential, makes them repel each other. But when you've got LDL cholesterol as a positive charge, and it'll stick the red blood cells together, overcoming the zeta potential. Triglycerides will do that in the blood. LDL cholesterol in the blood does that. Fibrinogen, the clotting protein, does that. Chylomicrons do that. Amyloid clots do that when you have activated fibrinogen. Okay, sticky platelets from sodium, that'll do it. Uric acid is a bridging molecule. LPS and LTA cause fibrinogen amyloid transformation. Iron overload causes fibrinogen amyloid transformation. All of that stuff makes the blood more prone to clotting. Being dehydrated makes the blood more prone to clotting. Being sleep deprived, drinking caffeine, being stressed out, all those things, increasing catecholamines and cortisol will elevate blood lipids and make the blood more prone to clotting. It'll also elevate fibrinogen. Okay, can atherosclerosis be reversed? Of course, or I wouldn't be writing about it. And Caldwell Esselstyn's reversed it. Every single patient who ate his diet, he said, never had a recurrent cardiac event. All right, so that's useful, really useful. Here's an atherosclerotic plaque, and basically the acute clot component can be reabsorbed. The lipid core, the fat in the macrophages can be reabsorbed, and the necrotic core, the dead tissue in the macrophages can be reabsorbed. Some of the cellular fibrous tissue can be reabsorbed, the collagen, but not the old, acellular collagen. Calcification, some people are saying it can be reabsorbed. I've never seen that, so I don't believe it. But the bottom line is a lot of it can be reabsorbed, and the endothelial cells, the lining cells, will start to secrete more nitric oxide vasodilator into the lumen. It's a gas that diffuses into the lumen, and that will cause vasodilation, opening up the artery even more. So there's a lot you can do very rapidly. You'll see improvement within a week and even more over time. You see all these patients with peripheral vascular disease who could barely walk a block, and all of a sudden they'll end up jogging a couple miles eventually. Quite often we see that. Okay, who figured it out as a blood clot? They knew that back in the mid-1800s, Dr. Karl von Rokitansky, okay? Then that kind of got pushed out of the mainstream when Ansel Keys did all his cholesterol work, and then they started selling the statins, okay? And Keys was a good scientist. He did good work. They try to demonize him, the paleo-keto carnivores, because he shows what a joke they are. So they don't like that. Here's a diagram from the work of Dr. Roberts, the things that he was talking about. He showed that if you look at a coronary artery at autopsy, it's significantly worse than what you see at cardiac cath, because let's say you're trying to assess this narrowing here. At cardiac cath, you're going to compare it to the adjacent, what they thought was a normal lumen, but it's really 50% stenotic already. So this is much worse. So what he's saying is it looks like a 75% stenosis at cardiac cath, but in reality it's a 95% stenosis when you do an autopsy, open it up for real. And what William Roberts showed was that you never get atherosclerosis just in one spot, like one lesion here, one lesion here. No, it's always diffuse in the vessel. So the only thing that's going to work long term is systemic treatment. So that's Dr. William Roberts, greatest cardiac pathologist that ever lived. He said single vessel coronary artery disease is a myth. It's always diffuse. You cannot effectively bypass it because it's going to be everywhere in similar severity. Here's one of the things he did. He cut every 5 millimeters. He cut up the little pieces into sections, and then he used that as a quantifying method. And he wrote some magnificent paper, something like his legacy paper, quantifying thousands of autopsies on people who died of heart attacks and cardiac arrhythmias and other control patients, etc. Anyways, and then he would assess every 5 segments, and he would grade the disease that way. And like I said, he said it's always diffuse throughout the coronary system, and it's always in all 3 vessels in similar severity. Okay. And here's Robert's quote: in a patient with acute myocardial infarction at autopsy, 34% of the segments had 76% or more stenosis. 38% were 50 to 75% or more blocked. And the point was the severe disease was extensive, with about 72% of the segments having 50% blockage. In other words, not a single segment was devoid of plaque. It's everywhere. It's a systemic problem. It's not just in one isolated spot. Okay? And he showed that, you look at the plaques under a microscope, they look like a blood clot. They can recanalize partially. They're laminated. All those things consistent with a blood clot. And like I said, I think statins are kind of stupid. They're a mitochondrial inhibitor, okay? So you're robbing Peter to pay Paul. You inhibit the mitochondria, you're going to increase your risk of diabetes. You're going to lower your energy production, maybe increase your risk of congestive heart failure or cognitive decline. Why not just stop eating the fat food and don't be stupid? Okay, so I go through all these studies, all that detail. Here's Gregory Sloop, pioneer atherothrombosis theory. Here's his book, Blood Viscosity, Its Role in Cardiovascular Pathophysiology. If you go to Amazon, last time I checked, his book was selling for about $130. And what I'm trying to tell you is, why would a book that normally would sell for about $40 cost $130? That's called a paywall. Because the billionaire perverts and the other people in the health business, they know that Sloop's telling the truth. And he's just basically supporting what Esselstyn said. You go low-fat vegan, you drop your blood viscosity. You can also drop your sodium out of there to get rid of the vasoconstriction and minimize it. Why wouldn't your flow improve? Okay. They don't want you stupid proles to know that this is the mechanism for atherosclerosis, because it empowers the individual to change their diet, change their lifestyle and behavior. Sloop himself would donate blood to drop his hematocrit, and because the lower your hematocrit, the less likely your blood's going to clot as well. You don't need to do that. That's a whole big topic. I've given other entire videos about that. So I'll pull off a couple extra tubes when I go for a blood test, but I don't donate whole units at a time. That could make you feel sick. Some people say it's no big deal. I don't like it. Zeta potential, negative charge outer surface of the red blood cell, bridging molecule overcomes zeta potential, sticks them together. IgM antibodies will do that. LDL cholesterol, triglycerides, chylomicrons, fibrinogen, uric acid, LTA, and LPS, and excess ferritin. They'll all do it. So you don't want to be iron overloaded. You don't want leaky gut. Okay. Higher your LDL cholesterol, the higher your blood viscosity, meaning the thicker your blood. So that means the higher your blood pressure is going to be, and that's going to be the more atherogenic it is. Red blood cell is about 7 microns in diameter, capillaries 5 microns in diameter. So the red blood cell has to deform to get through. It folds back on itself a little bit. If these things are stiffened up because they're stuck together by the high fat, then you're not going to deliver oxygen to your tissues as well. Okay. Plus, over time, there's going to be more glycation of the hemoglobin. All right. There's rouleau formation, also called blood sludge. Okay, Roy Swank, he's the guy who had the best results of anybody in the world for treatment of multiple sclerosis. He was good friends with Dr. McDougall. Here's his book, Multiple Sclerosis Diet Book. At Dr. McDougall's YouTube channel, Dr. McDougall Health Medical Center here on YouTube, he's got some good Roy Swank videos. Okay, the best one to watch though first is high-fat meal effect on blood sludge. Okay. It's only 50 seconds long. You want to see that, because once you see how the fat sticks the red blood cells together, you won't want to eat a high-fat diet again. And, all this paleo, keto, carnivore stuff's a bunch of nonsense. And a lot of patients, you have to get this through your head. America's not a Christian country anymore. You're not even a person. As far as they're concerned, they believe in atheistic Darwinism. They believe that you're just a monkey who talks. They don't care about you. They have no incentive to tell you the truth. They're going to give you this lying pile of crap that cholesterol doesn't matter, that paleo, keto, carnivore is good, that sat fats. That's all nonsense, okay? You go back and you read Kempner, Pritikin, McDougall, Esselstyn, and then you read blood physiology like Sloop, you read William Roberts' papers, and you know you want to minimize dietary fat. There's nothing ambiguous about it, okay? you have to remember, everybody has to lie to you because you make money by lying to the pros, okay? You don't make any money telling the pros, okay? As far as those guys are concerned, the high-fat phonies and all these big business people, I'm a loser, okay? Here I am making my YouTube channel. I don't have any sponsors. My channel's not monetized, okay? I'm shadow banned and ostracized anywhere I go. No one will interview me or talk to me. Why? Because I tell you the truth. And you know I'm right, okay? So I did a fellowship, by the way, at Harvard with the emphasis in vascular disease, okay? And I also did a mini fellowship in brain surgery and endovascular disease, atherosclerotic disease. I have been heavily into atherosclerotic disease for, since 1990, okay? I'm into it, okay? I know a lot about it, and I can tell you, you want to be about as low fat as you can get. My dietary fat's typically about 5% or something like that. Okay, the Nathan Pritikin he did a magnificent survey of all the literature on dietary fat, and his conclusion was fat is bad. Dr. McDougall, these guys are both geniuses. Nathan Pritikin, it's impossible to be too low in dietary fat with any naturally chosen diet. Dr. McDougall, he said fat is the biggest toxin in the Western diet. The fat you eat is the fat you wear. What are they saying? Minimize your dietary fat. All this stuff about good fats is a bunch of nonsense. Look at all these Asian people that were eating 1% of their calories from fat and white rice, and that was 80-90% of their calories. They were fine. You never heard about them having a fatty acid deficiency. Okay, I never seen a fatty acid deficiency patient in my whole life. Okay, that's a crock of BS. You can have a short gut syndrome if you had multiple bowel surgeries for bowel obstructions, Crohn's disease, or something like that, but that's a rare thing. Okay. And who's the diet doctor who showed all this stuff could work? Walter Kempner back in the day. He reversed all these EKG findings, reversed congestive heart failure, reversed diabetic retinopathy, reversed hypertensive nephropathy, stabilized a whole bunch of kidney patients, okay? And I got internal medicine doctor friends, they tell me it's frickin' ridiculous. Walter Kempner had much better results for the treatment of obesity, diabetes, hypertension, coronary artery disease, and autoimmune disease back in the 1940s, 50s, and 60s than they have now. Okay, why? Because he used a low-fat vegan diet. Okay, Dean Ornish also showed with a vegetarian diet dramatic improvement in coronary artery disease, and then the best results are Caldwell Esselson's low-fat vegan diet for reversing heart disease. Okay, and here's Caldwell Esselson. He says, some people think my low-fat vegan diet is extreme. He says, how about, 1 million people every year, 500,000, get their chest opened up with a buzzsaw and a vein taken from their legs sewn onto their coronaries. Perhaps that's extreme. Esselson says coronary artery disease is a paper tiger that need never exist. Yep, it doesn't exist in countries that eat a plant-based diet. Okay. Caldwell Esselson, he says low-fat vegan diet has 0% morbidity, 0% mortality. It's great. Every pill's got a bunch of side effects. There's no side effect except good ones for eating a low-fat vegan diet. Okay. I do think Esselson screwed up on flax. I think he got in a little over his head. You don't need to be eating flax. Okay, I talked about that in other lectures. You don't want, I like what Esselson said too. He said not one drop of oil. Okay, but to me that seems to be a real problem for the pros. They went to public schools and so they're real gullible. And they think, oh, well these doctors who recommend olive oil, they wouldn't lie to me. Of course they would, okay? Here's a good joke by Anton Chekhov, the Russian writer. He says, what is the difference between a lawyer and a doctor? A lawyer will rob you. A doctor will rob you and kill you. Voltaire had said, I want my doctor and my tailor to believe in God so they do not rob me. Yeah, duh, that's what I'm saying. The only thing that can fix healthcare is Christianity, and they'll never allow it because it says that all people are created in the image of God, and that which you do to the least of my brethren, you're doing to me. Here's a picture of the coronary arteries and the epicardial. So these are the big ones on the outer surface of the heart. So the big one is the left main. They call that the widowmaker. Then you got the circumflex, CX for circumflex, LAD for left anterior descending. What I'm showing here is a normal variant. It's a pretty common one. About 20% of people have this. Instead of having a bifurcation of the left main, you got a trifurcation. So it splits into 3 parts. So you got the circumflex, LAD again, left anterior descending. But you also got what's called a ramus intermedius. And the smaller these vessels are, and they're going to be smaller when there's 3 of them compared to when there's 2 of them, the harder it is to stent them, the harder it is to surgically bypass them, the higher your risk of having a heart attack. And what I'm saying is you don't know if you have this configuration. There's also configurations in the brain, whether or not you have bilateral persistent fetal posterior communicating arteries, for example. And when you have that, you'll have a small posterior fossa circulation. It's called vertebrobasilar artery hypoplasia, which will increase your risk of mural atherosclerosis, plugging off a penetrating branch to your brainstem or cerebellum, increasing your risk of a posterior fossa stroke. What I'm saying here is you don't know if you have any of these problems with your blood circulation. They're all normal variants, but if you eat a high-fat diet, they increase your risk of a heart attack or a stroke. Given the fact that there's a significant chance you could have these things, isn't it smart to be as careful as possible by eating a low-fat vegan diet? Of course it is, okay? I can tell you, my smart doctor friends go, yeah, it's obvious. Anybody with a brain in their head would get this, okay? Most patients, by the way, are stupid. The typical patient's like, well, I heard an expert on the internet say I could eat that saturated fat doesn't cause heart attacks. And I'm like, okay, dumbass, do whatever you want, It doesn't matter to your doctor if you die. I mean, who cares? The doctor's not paid whether or not you do live or die. They're paid whether or not they generate a billing code when you visit them. Okay, so I tell you that because your life belongs to you. You make your own decisions. The doctor is obligated to follow standard protocols and guidelines to meet billing requirements for insurance companies. That's it. Whether or not you live or die, that really doesn't matter. That doesn't change how much they get paid. You need to know that. All right, so anyways, that's it for atherosclerosis. I got other lectures. If you really want to learn about atherosclerosis, I have a whole playlist where I go through every detail in minutia. But I've just given you the main points here. Atherosclerosis is a blood clot. It's a systemic disease, meaning it is everywhere. It is always diffuse. Single vessel coronary artery disease is a myth. It's always diffuse, meaning that there's only two ways to treat a diffuse disease. You either fix your diet and lifestyle or you take pills. And the fixing your diet and lifestyle works much, much better. Okay? So anyways, that's the scoop. I hope you found that helpful.